that campaigners warn that 90% of people in poorer countries will not get the vaccine in 2021. Although they are here talking about the Pfizer-BioNTech vaccine, this statement probably will hold true for a majority of the vaccines that will be approved in the next maybe months, or let's say within the next few months. Accessibility of these vaccines to developing countries. So about 90% of people, and therefore quite a good number of countries, developing countries, may not have access to these vaccines. The second point I want to make with this slide is the prominence they are given by political systems. And here you can see, for the one in the US, you can see Governor Cuomo making speeches and comments on the side on the same day that the vaccine was being administered to the recipient. I can't quite see, but I wish I would see the people being vaccinated in the US. There, I just call your attention to, again, representation of individuals on that slide. The person being vaccinated, the age of that person, and the person administering, or the medical expert administering the vaccine. Those are important because they have implications for us in Africa or developing countries. Here then we come to the important points that we want to talk about, which is really the essence of this presentation. One is the acceptance of these vaccines by the target population, given the campaigns that are raging against vaccines in general, and these vaccines in particular. One issue. The second one is accessibility of these vaccines and their suitability for general use in developing countries. And here I have in mind African countries. There are a number of things that are peculiar about Africa. Again, we could discuss those, but they do not form part of this this presentation. Many of you will be aware of very aggressive campaigns that exist against vaccines in general. These messages are posted largely on social media, but some of them get to print, either in small circulation publications that may be electronic or printed, but they are very widespread and quite aggressive. Many of them are veiled, but some of them very direct. I would say in most instances they are mixed with half-truths. But nonetheless, people read them, pay attention to them, and they are having effect. Because if they're not having effect, they would not be posted, and not on a continuous basis anyway. And there's real concern that these messages are reaching Africa and could have negative impacts. The consequences of these messages is that they this slide, yes, they somehow shape public perception of these vaccines, resulting in reluctance or refusal to be vaccinated. And without appropriate information, people are very confused, or they can get confused as to options that they have regarding the vaccines. And sometimes they are unable to decide as to which vaccine, if they agree to be vaccinated, they should be vaccinated with. Given that this misinformation is widespread, I think we as Africans should make sure that they do not take root. And if they do take root, they could be disastrous in many respects. One, they could make vaccination against COVID very difficult, much more difficult than it already is, compounded by other things. And the consequence of that is that the safety and health of the continent could be compromised. this will have not just direct health effects, but could also have effects on people who travel, people who do commercial activities with others, the rest of the world, and therefore it could spill into economic ramifications. As I said earlier, these pieces of misinformation are very many, but they can be grouped into a number of categories. There are some which are directed at vaccines in general. So a vaccine for any disease whatsoever. Then there are some which are addressed to specific vaccines, and others are addressed to specific companies that manufacture vaccines. Or they could be directed against an individual, even if they are only remotely connected to a vaccine or vaccines. In all these cases, there are specific examples, but for now, it would be better not to go into specific examples. But I'm sure some of you are familiar with, in each category, some company or some vaccine or an individual who has been a target of these misinformation groups.